This is Roy. Something I would have done differently in high school would have been to enroll in those classes that give you college credit in addition to your high school credit. At the time, I saw it as something for overachievers. But then later on, when I finished high school and I was responsible for paying my own way through college, I realized what the benefit would have been both to get ahead of the game and also financially as well.
As I think back on it, now you have to put it in context. I went to high school in the 60s. And so back then there were sort of two tracks. There was the college track and the business track. And somehow or another, they put me into the college track. I think it was a hopeful thing. But the two classes that you didn't have to take in the college track, were typing and shop. And as I've gotten older, and as the world has changed, the two skills that I think I am really deficit in to this day are typing, and Kate will verify that. And I really would like to have better shop classes. So I think those kind of hands-on things, I would change that in a minute.
This is Sylvia. I think that I would have paid closer attention to social services type courses, sociology, psychology, even home economics. Those courses that are so critical now because of understanding the social determinants of health, social determinants of education, and how critical they are to understand beyond economics and beyond a skill set, other factors that impact everyday people in their ability to move forward. Things that they're born into, that they can't necessarily change, and others don't necessarily understand. So not that we're creating opportunities that we don't create for anyone else, it's that we're leveling the field to some degree because we don't necessarily take advantage of other skill sets or other potential workforce out in the world because their opportunities are scaled down because of social determinants.
I would say for me, I would maybe have taken more time to think about what it is that I'm passionate about. And I know sometimes that doesn't necessarily come clearly until you later on in life, but just find something that really makes you excited. And then while you're thinking about pursuing that career, find maybe like an entry-level position somewhere where you can start actually like learning and seeing for yourself what it is. I kind of ended up doing something like that anyway. I thought I wanted to go into nursing, so I did a medical assistant certificate and I got into that and I loved it, but it wasn't my thing. So, but I wish I would have thought about that earlier on and then kind of taken it from there.
All right, we just have a few more questions that I've put together, and then I'd like to open it up to the audience to ask questions. So if you're thinking of questions now and you'd like to put those in the chat box as we move along here, that would be great. We could go on to the next question. Just one more. One more. So a lot of you are in positions on the panel where you are the decision makers and you are interviewing and hiring new people for your team. So in your experience, in your current position or over your career, what is one of the biggest turnoffs when somebody comes in to apply or interview for a job?
So this is Sylvia. One of the things that I find concerning is when applicants don't answer the question. And along the lines of when you ask for an example of when have you done this? And all your answers are hypothetical and it depends. There is low commitment to having a firm answer. Of course, unprepared, that's part of being unprepared. So those are my concerns. You know, Kate, one of the things, this is Sylvia again, one of the things that makes it easier for applicants now is also the opportunity to have telephonic interviews. They're more frequent now, and the importance of that practice, because the nonverbal communicators are not part of what carries a conversation now. So you may say something sarcastically on the phone, and with the visual, it could give it a different meaning and engage your interviewer. With those don't necessarily translate telephonically, and therefore the interview skills that people need are very different. The ums and ahs and those silent pauses, like the one we had in between my conversation and my conversation, are very, very awkward. So the element of being prepared to answer, and even to say, let me take a second on that, give me a few minutes to compose my thoughts, are activities or skill sets that people need to develop. People also need to develop or at least practice how they sound on the phone, either by recording their calls, because I see some excellent resumes, and those excellent resumes do not translate into excellent communication skills. I've always focused on that, and I never met Griselda before I hired her, and she showed up her first day on the job. We had a telephonic interview. We had a follow-up telephonic interview where I too interviewed her in Spanish. I interviewed her in English, and then I interviewed her in Spanish. And this is one of the funny elements of the job. Someone reported that Sylvia was always talking Spanish on the phone. They didn't realize. So they didn't know if I was working. I was always speaking Spanish on the phone. And it was that I wanted to make sure that if someone was going to be hired as a bilingual rep, that we could have a discussion about healthcare in Spanish, just like we have a conversation in English. And we'd follow up with a certification course, but I'd always say is, if I'm hiring a driver, I need to know that they have a driver's license. If I'm hiring someone who says that they're bilingual, I need to know that they're at a place where I could work them into the system. I don't want to have to teach them Spanish, because then that wouldn't be fruitful. So I think that we should all be looking at recording ourselves and listening to how we sound. And the other thing that we should do is how we appear on audiovisual.
That's a really great point, Sylvia. And two different things there is, Sylvia also interviewed me for my job, and I remember one of those awkward pauses where I had to be like, I think I need some time to think about that, because she asked a really deep, thoughtful, meaningful question, and had to take that time to just pause and collect myself and come up with an answer that really brought to light who I was into the position that I was applying for. Another thing, going off of that, recording yourself, I mean, in the digital and technology age that our kids are living in, having that opportunity to do just a 10 or 15 minute recording of yourself. One of my first, the college that I went to, before you're even admitted into the school, they give you 45 minutes to prep a presentation on a certain topic, and then you have to give a 30-minute presentation on it, and you're recorded. So at the beginning, very prenatal stage of your career path for college, you have that video, and then you're recorded as you progress through your college career. So when you graduate, you're able to look back at that first video and be like, wow, this is really where I came from, and hopefully you've changed.
Kate, the thing that Sylvia kind of reminded me of a kind of a quality that I really value when I hear it, but I didn't hear it very often, is the difference really between an applicant that wants a job and maybe wants a job desperately. I mean, you can really see it, and who desperately wants to work with you. And the indicator on that is how much time and effort have they put into before the interview, really learning about your company and learning about what this job might do. And it might even, the image they have may be off a little bit, but I was constantly impressed by somebody who actually knew what we were about, had an idea about what the job was, and then could describe to me how they might add value to the company while they were performing the job. So they could really tell you about what they would do to keep it versus somebody who was really desperate to get a job, and all they can really talk about is how much they'd like to get it. So I'm kind of always looking at that keeping side, and a little bit oftentimes suspicious about somebody who's really can tell you only why they want to get something.
That's a good point, Bill. And something that we talked about with our educators last year is, yes, you may get that position, but also from a self-assessment perspective, knowing if that really is the right position for you. You're selling yourself to them, but at the same time, that company is selling them their organization to you, and really recognizing that it might not be a good fit, and knowing it's okay to say no to a position as well. Well, it looks like we're just getting at our 10-minute warning here almost. I'd like to move on to our next question and then open it up to questions that you may have. What are some reasons that people get fired for in your business?
Kate, this is Sylvia. I would have to say lack of attention to quality, customer service, and attendance. I don't think I've seen maybe one or two that are outside that scope.
This is Roy. From my experience, it's very similar to Sylvia. Yeah, attendance and also a lack of motivation. During my time working at 1-800-Medicare, I was in a supervisory role, and I had to let go of 3 employees for call avoidance. They just weren't really motivated to do the work that's required of the job. And when you work in a call center, your job is to answer calls. And they didn't enjoy their job, and obviously they didn't want to take calls, because when the calls would come in, they would just transfer them back into the queue. So that's just an example from my experience.
I agree with Roy. I've also seen that lack of motivation has a lot to do with it. And I think it goes back to what Kate mentioned, making sure that that's the position that you want to take. I mean, not just because it sounds like a good deal. It has to be something that you're going to be committed to, and just give it your best.
Well, it looks like a few questions are coming in from the chat. So I'd like to answer the one that just came up right now, and then we can open it up to the floor. So Jennifer asked, this is directed towards Sylvia, but anybody can feel free to answer it as well, as what is one thing or a couple of things that you look for when you're fielding resumes?
So one of the things that I look at in resumes, of course, Banner always does preliminary fielding. So we get candidates that Banner believes are qualified. I look for, at resumes, I look for thoroughness. I look for gaps. If there's a gap in the resume, identify that gap. And I also look for grammar and punctuation. Those are key points that I look at. And then I look at the experience and whether there's been customer service involved, because I have staff and trainers, and I myself can train to how to work a function on a computer, how to complete an Excel spreadsheet, but I just can't teach pleasant. I can't teach that smile and that want to be there character.
We're just about 5 minutes left. Are there questions from the educators? Feel free to shout them out and we'll get as many of them answered as we can. Feel free to take yourself off mute and shout it out.
I see we have one question from Jane stating, can you summarize the top employability skills in the healthcare sector and what are some resources for students interested in healthcare careers?
So I can answer that, but I can answer that from the healthcare perspective in the health plan arena. I think that the area of claims adjudication, claims management, coding are critical. They would work both in the provider field for billing for services, and they would work as well as in the healthcare facility in hospitals, and also on the health plan side for payment of claims. I also think that claims payment is critical to quality, because understanding why patients, members are accessing healthcare, seeing what providers are billing, and being able to make accurate predictions of what the trends are within the healthcare arena, all go back to what a provider bills and what a member or patient goes in to seek healthcare. I think that's just a critical element. And it fits into so many aspects of healthcare.
Thanks, Sylvia. Somebody else just chimed in that, can someone talk about the entry-level positions and the many other health job roles that are not directly healthcare, which is primarily everybody at our health plan, so HR, marketing, nutrition, etc. Griselda or Roy, would you like to chime in?
Sure. So the question, this is Roy. So the question is, what are some examples of entry-level positions at the health plan?
Yes.
Okay. Well, off the top of my head, the call center, that's definitely entry level. That's where, like Sylvia explained, a lot of us got our start. You know, we started off in the call center, and I do have to give a lot of credit to call center representatives. That's one of the few jobs that you work from the moment you get there, almost all the way to the moment you leave. There's no routine coffee breaks. There's no just walking away when you want to. You're there answering the phones all day long. So even though it's an entry-level position, it is a very demanding position, but it's also a very rewarding position in the sense that you get to experience the challenges that in our case, our health plan members, our Medicare beneficiaries, our access enrollees, the challenges that they face, and understand the healthcare system and get a better perspective than most people in other parts of the organization. So the call center is a good example. Claims, a lot of healthcare organizations will take entry-level candidates to do claims processing. My wife, she actually works at a competitor health plan. I won't call out which plan, but she works for one of the competitors, and she started off as a claims analyst, an entry-level position, and she's worked her way up to senior supervisor. So those are just two examples, at least for the health plan side of the healthcare industry.
All right, thanks, Roy. I'd like to say a thank you to all of our panelists for joining us today, and for all of you educators for taking this time to be with us this morning. I want to make sure that you guys have enough time between this session and your next one. Catherine, any other announcements from you?
No, I also want to echo thank you everyone for joining us today, from the fabulous panelists, from Kate and all the educators. Hopefully you guys got a lot of great information, and we can definitely follow up to share contact information for any kind of follow-up that you guys may have with Banner, and wishing you guys luck on your other sessions that you guys have today.
All right, thank you everyone, and I hope to see you tomorrow for the feedback session. Enjoy the rest of your day.
Thanks, everyone. Thank you.